Hi, this is Kirk, the Bariatric Carnivore. Back in my old doctor's office, he used to have a sign that said, maybe it'll just go away. These are the most dangerous words in the English language. And, and I used to chuckle at it because it's, good sentiment. That there's some things that lifestyle will not fix. Your magnesium supplement will not set your broken leg. You have major trauma, you need to get medical care. But there's another sign that has replaced that one that I see in too many doctors' offices, which is don't confuse your Google search with my medical degree. And when I see that, I'm out. I find that to be the height of arrogance, and frankly, that is not the message you want to be sending to patients. The reason why patients come to you is because they realize that there's an issue that they have discovered that they cannot fix on their own, and they need a trusted advisor. And I don't need an arrogant twit that is siloed in a medical system that does not give them a bigger picture. And frankly, one of the advantages we have in this day and age is we can Google things. And it can be very powerful and it gives us some advantages that a lot of doctors don't have, and they really need to start to embrace it and talk about, empowering patients to start looking things up, because frankly, it's like Maslow said, if your only tool is a hammer, then you start to look at all the world as nails, all your problems as nails. And that's the problem with too much of medicine. I had a problem with this finger here. It's called the ulnar nerve, and it was the result of the heart surgery. And sometimes they move your arm in a certain way, and it's well known that after heart surgery there's often problems with the ulnar nerve. And the advice I got from the heart doctors and stuff like that was, well, it takes a while for nerves to heal, and in a few months, if it doesn't get any better, we'll send you to a neurologist. Well, see, this is kind of the problem with the heart surgeons are great at hearts, but they don't know anything about nerves. They're not physical therapists. They're and they're kind of limited because they're siloed. They know their specialty, but they don't know the bigger parts. And they don't know anything about nutrition. They don't know a lot about lifestyle. There's a lot of things they don't know. They know a lot about their specialty, but not about this particular problem. This particular problem, if you go to a neurologist who, specializes in hand surgery, guess what he's going to recommend? Hand surgery. Well, are there other alternatives? Well, thankfully, I Googled it and found out that yes, there's things, the ulnar nerve can get impinged in the shoulder and in the elbow, and there's some things called glides or flossing, which helps you get the nerve back in the right place. And by using an elbow brace at night to keep the elbow from, moving into the wrong position, you can also improve your chances of getting that healed without surgery, without requiring any drugs or anything else. And how did I figure this stuff out? By Googling it. You start looking around and figuring out the symptoms. Okay, this is tingling. Oh, that's what that's called. And you find some really good sources, and there's lots of people that have suffered through the same things that you have, that have found solutions and share them, and some of them work, some of them don't. I mean, frankly, some of them are twits. I mean, you can tell pretty quickly, and if they're trying to sell you something, I generally don't listen to them. But, I've solved a host of different medical problems over the years just by Googling it. There was a time when I had an impingement in my shoulder, and it hurt to lift my arm, and I didn't really want to go to the doctor for it. All I was going to do from that was going to get medication, but I Googled it and found this bobandbrad.com website. They're the two most famous physical therapists on the internet, according to their own opinion. But they are, two very good physical therapists from Minnesota. Have a great website, lots of videos on a lot of different problems, and they give great advice. And they said, look, you got that shoulder impingement? It's one of two things. It's the nerve going over or it's going under in your shoulder blade. Here's 2 moves that you can make. Very simple. Figure out which way it is. Did the exercises and it's like, oh, okay, it's under. Okay, then you need to take a band, pull this way, and do it for a few days, and sure enough, it went away. No muss, no fuss. And the problem with a lot of what's going on in medicine is, you as a consumer need to be able to find the people that have the particular expertise that you need and to figure out the type of treatments that you want. And you need medical advice. There's certain things you can't do, but this is the thing that I utilize the internet for as a good search engine to help me figure out, okay, what type of specialist do I want to talk to, and what type of skills do I want them to have, and what's really nice nowadays is you can get fairly inexpensive consulting with some of the best experts on the planet on the internet. Just have a video chat with them, and you can chat with them $50. Find for 15 minutes, figure out, okay, this is the type of person I need for my particular problem, and I can have an intelligent conversation with the doctor without getting sold something that I don't need. I mean, how many times have you heard of somebody that went to a doctor and suffered a lot of things that they didn't have to do because they went to the wrong specialist? They went to the wrong person that could not solve their particular problem, and they wasted a lot of money and a lot of time. And you can avoid that by utilizing the Google searches, because frankly, if you're trying to get nutrition advice and diet advice from your doctor, they don't know it. They really don't. I mean, you can ask them, how much nutrition training did you get in medical school? And frankly, most of them got 0. That's unfortunate. That should be, let food be thy medicine was one of the, principal things of early medicine, but we've lost that. There's a lot of stuff with physical therapy that a lot of doctors don't know because they don't specialize in that. There's a whole host of different areas that your doctor just may not be aware of because it's not in their silo. So don't be afraid to Google things. Utilize the many resources that we have. Be thankful for them. Utilize them well. And realize that there's some quacks out there, and there's a bunch of stuff that just frankly doesn't work. I mean, if somebody's trying to sell you, the supplement that's going to cure your cancer, frankly, I'm not all that interested in it. But when I find people that talk about utilizing diet and lifestyle as part of the overall treatment options for cancer, I'm listening, because frankly, I'm finding more and more that it is possible to solve a whole host of different diseases and problems utilizing lifestyle to help make your chances of getting a full recovery done and get it done better. And that's what it's all about. And that's what this channel is about, to help point you in the right direction. So highly, highly recommend the bobandbrad.com website. If you've got, life's aches and pains, I think you will like them. And they have a lot of great stuff out there. So, utilize these type of resources. Utilize Google searches. Don't just take, the word of a person who's in a particular silo, because, their only tool is a hammer. Utilize, try to find the people who have the right tools for your need and what you're comfortable with and what you want to accomplish. This is Kirk, the Bariatric Carnivore. Try to put out a couple messages each week. If you like this message, please hit like and subscribe. Join this channel. Join with other like-minded people who realize that, look, in this fight for our health, we are all alone. But we can all be alone in this together. I will talk to you again soon.